Hello and welcome to Meet the Member. My name is Lynn Allen Sione. I'm the president of the Orange County Chamber of Commerce, and I'm very pleased to have you join us today. Very excited and very honored to have our guest with us today, who is Dr. Ken Steyer, the Dean of Touro College of Osteopathic Medicine in Middletown, New York. So, Dr. Steyer, are you there?
Thank you for
There he
having
is.
me.
There you are. How are you?
Good. Thank you very
Good.
much.
Good. So it's been a long couple of months, I'm sure, for all of us, and especially for Touro, a lot of changes. But we want to thank you first and foremost for everything that you folks have done during the pandemic. And also from the Chamber's perspective, thank you for being a member and thank you for being one of our gold partners. As we've been saying to all of our partners, that without your support, we wouldn't have been able to do the advocacy and the one-on-one assistance with the small businesses over the past 5 months now. So we really appreciate your support, Dr. Steyer. It was a lifeline for many people. So we appreciate that very much. So let's get right into it. And if you could just give us a little bit of background about Touro and what kind of medical hospital it is.
Okay, so Touro is a pretty large organization. We have about 35 different schools, colleges, professional schools, graduate schools, actually all over the world. We have schools in Berlin and Russia and in Israel, outside the United States as well. It was created by a rabbi, Dr. Lander, back in 1972. He was a vice president at City University in the city. And at that age, decided he would like to have his own school. So he created Touro. So they developed an undergraduate school in the city and then a law school, which is now on Long Island. It had started in Huntington, Long Island, and is now in West Islip. And developed a graduate school of business, social work school, several other schools, and then expanded nationally and now runs 5 medical schools. So we have medical schools in California near San Francisco, in Nevada. We have Touro College Osteopathic Medicine, which is the medical schools in Harlem on 125th Street, across the street from the Apollo Theater, and the school up here in Middletown, which opened up in 2014. So we're going on 6 years. And then New York Medical College in Westchester is also part of the Touro system.
Oh, okay. Yeah, I didn't realize that was also. So it's a very, very broad educational system.
Yes, we have about 20,000 total students. Very broad, lots of offerings, but really a special concentration in healthcare. Nursing, physical therapy, occupational therapy. We have several physician assistant schools, and we plan to open up a new physician assistant school up here in Middletown, hopefully in January. It's going through the accreditation process now, and if it gets accredited, which we hope it will, it'll open up in January. So here in Middletown, we opened in 2014. We have 135 students in each class. So there's 4 years of classes in medical school. So that's 540 medical students. And then we have a master's program, which is kind of a pipeline program, which has about 80 students. So we currently have about 600 students here in Middletown from all over the United States and even some from Canada. So maybe half of our students come from the New York, New Jersey area, but the rest are from California, Texas. You might see the license plates driving around. If you see license plates from out of state around Prospect Avenue, they're probably medical students.
So if Touro in Middletown, if you've been there for 6 years now, you've already graduated some of your classes.
Yeah. We've graduated 3 classes. We always have until this year, until the pandemic, we had our graduations at the Paramount Theater downtown. But this year, of course, we had to do it virtual. But we have graduated 3 classes, and many of our students and graduates have stayed in the area.
Oh, that's great.
Many are over at what was Orange Regional Medical Center, now Garnet Health Medical Center, doing their residency. We have a very strong affiliation with the hospital that actually helped us get started and takes a lot of our students for rotations. So many of our graduates have stayed. And some of the people who even finished residency now at Garnet Health Center have stayed in the area and taken jobs either in the Orange Regional Medical Group or at Cornerstone Healthcare or Horizon Medical Group or other medical groups in the area. So our goal has always been to increase the number of physicians, especially in primary care, working in this area, Orange County, Sullivan County, Putnam County, etc. And so far, at least, knock on wood, that's what's happening. They come up here, not everybody knows how beautiful the Hudson Valley is. Mm-hmm. Not everybody knows about the Orange County Chamber of Commerce. Not everybody knows about the great members and the great opportunities up here, the West Point, the walkway over the Hudson, many people have heard of the factory outlets in Woodbury, but, or if they're older, like me, they remember the Borscht Belt and, Kutcher's and everything. Sullivan County, where we all used to come from Brooklyn to spend our summers. But in between, there's a whole generation of people who do not know so much about the Hudson Valley, but when they come up here to go to medical school and see how great it is, we have a wilderness club, hiking club, all that kind of stuff. So our students become, very interested and wanting to stay up in the Hudson Valley. And with everything that's happening with the pandemic, I think they realize what a great option it is.
It is. It's a great option. And I think it's pretty much every year Nat Geo says that the Hudson Valley is one of the places that people have to visit around the world before they pass on, because it's one of those spectacular places that isn't replicated anywhere else. It's like the Grand Canyon. Right. But it's the Hudson Valley. There's a lushness here, and there's such a diversity among the communities. So if, when students come up here, if they're not used to it and they think that it's New York and it's going to be one big concrete jungle, they're in for a surprise. Right. So it's a magnificent place, the Hudson Valley. And we're just really thrilled that Touro has chosen to come here, because I remember the work that was put in a lot by Mayor DeStefano to get Touro to come, because it is so important, and we do need those PCPs. It's really, really important for us to have those primary care physicians for all people to have access to that. So the more PCPs, the more doctors are up here, the higher the level of access is. So you had mentioned that some of your students have stayed here for residencies. So while they're doing like their internships, are they also going to Cornerstone and Garnet and Horizon?
Absolutely. Yeah. For their rotations during internship and residency, 100%. So we introduced them early as first and second year students to the different healthcare providers in our area. And they may start off at volunteering or community service. Several of our students, for instance, during the pandemic, were working at the Department of Health, working for Dr. Rena Gelman, doing tracer methodology and returning phone calls. And many of our students volunteer at Honor, the homeless shelter. Mm-hmm. Many of our students, volunteer at Cornerstone and other sites as well. So this is even as a first or second year student. Then as a third and fourth year student, they rotate at those sites. And then, when they become a resident, then they rotate again, but now as a resident at many of those sites. So the continuity and reinforcement and familiarity that's there, it's just tremendous. We can completely train them here in Middletown, which is, a very ideal circumstance.
Yeah, I would think so, as opposed to, having to do one rotation here or rotation, 100 miles away or 50 miles away. If you have everything concentrated, it's probably easier for them because they're already part of this community. So they're able to stay with their friends. There's a comfort level with that, I would think.
Right. Most medical schools do not have, their own hospital or a hospital close by, like Garnet Health is to us. So it's a huge advantage to have a 400-bed hospital that was voted the most beautiful hospital in the United States, which is pretty much still brand new, which offers incredible medical services. And for our students to be able to train and rotate there, it's just really an ideal situation.
You had mentioned about some of the things that your students were doing during the pandemic. Can you elaborate on that? Because it was vital for all of the health partners that are out there. I really truly believed helped us to not be as impacted as we potentially could have been. So could you just share a little bit so people understand just how important it was, your involvement with all of that?
Yeah, we were asked, the medical schools in New York were asked by Governor Cuomo's office to consider graduating their senior students early so they could start working early at the hospitals to help with in the pandemic when the hospitals were very much overrun. And so we did that. We graduated our students about 6 months
Wow.
early, our senior students, so they could get started early, volunteer, and help during the pandemic, which they did. And many of them volunteered and worked during the pandemic. Even before that, in early March, our students were volunteering at the Department of Health, like I mentioned before,
Hmm.
contacting people, scheduling appointments for COVID testing, and like that. And then our students were working in several of the other healthcare providers in the area, especially our senior students, to help with COVID testing and tracers. So yeah, we really worked hard to support the community in terms of the pandemic, in terms of testing and tracers, and really trying to help get us through that. Thankfully, things are a bit better now, at least up here, and the prevalence rate is a lot lower. And the students, are just doing their regular service that they've always done.
So now school has started again. We're still in the middle of a pandemic. Governor Cuomo hasn't said, "Yay, hooray, we're out of it." So what does it look like at Touro now? We hear about what it looks like in the schools, in the public schools, but we're not really hearing a lot of what the colleges look like.
Yeah, so our school, we started, the building reopened on August 3rd, and that's when classes restarted as well. Medical school year is a little bit different than the regular academic year. So we start August 3rd, and we're doing a hybrid model. A lot of our classes are remote, online, which is how a lot of our curriculum was anyway, even before
Oh,
the
okay.
pandemic. A lot of IT, a lot of online. It's how people learn these days, right? So a lot of our curriculum is online anyway. But we are having the students come to school for labs, because physical diagnosis, taking blood pressures, looking at eyes and ears and stuff like that, you can't really teach that very well remotely. Uh,
No, I think not.
right. And for exams, we're having the students come here so that they can take their exams in a safe and proctored and quiet setting. It's hard for a lot of our students to take exams at home. The dog's
Oh,
barking,
sure, sure.
crying, whatever. So we have a safe, quiet environment for the students here. But we've done all the social precautions. We take temperatures. We do a daily health screen. We all have masks that we wear in the building when we're not in our
Mhm.
office privately. And we're following all the social, and knock on wood, we've been pretty safe so far. I know a lot of colleges, have had different issues with
Right.
college kids because, a lot of times they're not necessarily getting sick COVID at the school, but the other places they're going,
Mhm.
COVID parties, the beach, what have you. But we're keeping a close eye on the medical students. The medical students are a little bit older, than college
Sure.
students, a little bit more responsible. We reinforced with them from the very beginning that we're going to need you to be responsible, etc. Wear your mask, and don't travel to pandemic areas. That's a big issue for some of our students because they have family all across the United States. So of course they want to be able to visit their family during school breaks and
Of
things like
course.
that. But we can't let them. I mean, we tell them if you go, you got a 2-week quarantine.
Right.
When you come back, you're going to have to be tested. If there's a way to avoid it, you should certainly avoid it. So our students have been pretty responsible, and we keep after them. We have to remind them a little bit, but so far everybody's been doing the right thing, and we've been able to avoid any serious problems on campus, at least related to COVID.
But that's great. I know I just had a grandson, and
Congratulations.
yeah, thank you. The heartbreak for me is that he's in Alexandria, Virginia, so it's a trek down there, but it's one of those states. And so I think we've all had to readjust our thinking on this because many of these states are on this quarantine list. And, when you go there, you do have to come back. I had a quarantine for 2 weeks because you just don't know. Their transmission rate is, higher than ours is, and you don't want to come back and have people get sick. So along those lines, we spoke a little bit before we started. And this is where I'm going to rely on you as a doctor now. But we spoke a little bit earlier about, there's all this confusion, depending on what outlet you're listening to, the information comes this way. If you're on Facebook, the information comes this way. So there's a lot of confusion about masks, social distancing, are we through a pandemic, transmission, aerosolized particles, all of that. If just somebody listening today, what is your advice about, continuing to social distance, or really anything about some of the things that are coming out?
Yeah, I think we do have to follow all the precautions from Dr. Fauci and the CDC. Certainly wearing the masks, anywhere we go outside, is a must. Avoiding, right now I avoid the subway and the bus and stuff like that, and any closed space with a lot of people, 100%. And I think we're doing well up here, in the Hudson Valley especially. But I think we still have to be very, very vigilant, very careful. I do not recommend, I would not get on a plane right now. I would not myself. Or be in any situation and in close, because you don't know where the other people have been and what they might have. And so I think we have to maintain our vigilance up here and be very, very careful and follow the CDC guidelines, wearing the mask, and avoiding places where large groups of people who you don't know.
Right.
I've been to the Galleria. I walk through the mall. It's it's not so crowded. Keep my distance. 6 feet. I was in Cumberland today getting my coffee, 6 feet a distance, wearing a mask. And so far I was COVID tested because I had to have a routine screening procedure done last week. So you have to be COVID tested to do it. So luckily I was negative, but I'm worried about my wife and, my daughter and stuff. So very, very careful, wear the mask, do what you got to do. The prevalence rate here is less than 1%. Up in the Hudson Valley, let's keep it that way.
And it's the prevalence rate. Just because it's low doesn't mean that the virus has gone away. It's just that I think, that's something that's important. I think for people to recognize it hasn't gone away. So now we're coming into also flu season. So now, do you recommend flu shots? No flu shots? Maybe a flu shot
Always,
on Wednesday.
Always. Even regardless of COVID, always the flu shot. The flu shot is. Vaccines such as the flu shot are why people live to be, 100 now and not 40 like they used to. So things like vaccines are lifesavers. And the flu shot, not perfect, right? Because they have to predict 2 years ahead of time what the flu is going to be 2 years from now so that they can produce it and design it. So it's not going to cover exactly whatever virus strain of the flu is out that year. So it might only be 70% effective or 80% effective, but it's not bad.
It's better than nothing.
2 years ahead of time. And sometimes it's more than that. And even if you still get the flu, it'll be a much milder flu. And, the flu kills people who are vulnerable, just like COVID, older people with emphysema, diabetes, other medical problems, heart disease. The flu can be a killer. So the recommendation now, I just saw from Garnet Health Center, they want all the employees to have the flu shot by the end of October. So I would encourage everybody to get their flu shot. I'm going to go get mine this week. And hope you can't get the flu from it's a dead vaccine. You can't possibly get it. You can have a local skin reaction. Sometimes your arm might get a little red, but to avoid a serious flu episode, it's definitely worth it. So I would strongly encourage everybody to get their flu shot.
And it may seem like a silly question because you're a doctor, but does the flu vaccine prevent the COVID virus?
The flu vaccine, because it's a different virus strain, it won't, prevent COVID, but it may minimize or reduce the severity of the illness if somebody did get COVID, because there is some crossover between the viruses, so there's some similarities. So anything that enhances your immune system.
Right.
What may help fight the initial infection from the COVID. So it may help somewhat.
Makes somewhat, but you should
So
still have it anyway.
it's not a substitute for an actual COVID vaccine, which hopefully we'll have very soon, and it seems like we might. But the flu vaccine will not yet prevent COVID, but it might help.
So there's going. Just because of this is on so many news outlets and stuff. If somebody's going into a mall, if somebody's going even outside, when should they wear a mask? If they're outside, should they still wear a mask? If they're going to be around people, if they're going to be farther away than 6 feet, should they not wear a mask? What would you recommend?
Right. I think according to the CDC guidelines, at least, if you're more than 6 feet away and you're outside, you probably are safe without a mask. If you're more than 6 feet away and you're outside.
Okay.
If you're inside, absolutely you need a mask. And if you're less than 6 feet away, I mean, the 6 feet comes from a few studies that show that droplet spray goes less than 6 feet. So, and the droplets is what carries the virus. So if the droplets can't get to you, you shouldn't be able to get the virus. And especially if you're outside on a windy day like today, it's unlikely that you get inoculated with virus. But any enclosed space, the mask has to be on. So even the mall or shopping or Hannaford or ShopRite or Price Chopper or wherever you go, the mask is, they won't let you in for one thing.
No, that's true. They won't. You can't really get in anywhere without the mask. And, I know, like you had mentioned the mall, the mall's any place where there's multiple dealers or multiple vendors or anything like that, lots of people, it becomes a mall, and they have to have special air conditioning units and everything else if there's different store owners in there. So
we did that too here at the school. We added filters to our air. Well, we had to make it safe, for everybody. And for our students, faculty, staff. So we put in special air filters. The filters are so small now, the pores in the filters to let stuff through. It's, a challenge for the air conditioning and everything else.
Sure.
We put in the HEPA filters that would presumably catch any particles that were out there.
Well, thank you for doing that. That's very responsible. Because I don't think you were mandated to do that. So doing that shows, the intentionality and the care. And, Touro has really been, in the short time that you've been here, you've only been here 6 years, but really in the short time that you've been here, Touro has really become part of not just Middletown, but really all of Orange County. You're part of us as a chamber. You're part of one of our corporate partners. We're, very involved with all of these health providers throughout the county. So thank you so much for everything that you do, Dr. Steyer, and everything that your students do. What does the rest of the year look like for your students now? Are you going to continue with the hybrid for a number of months, or is that until further notice?
Well, the fall semester continues through December, and then the spring semester will start in late January, and we'll make a determination based on prevalence and what have you in November, December, as to what to do in the spring. We'd like to be in person, to be honest. We'd like to be back in person because for medical school with anatomy lab and physiology,
sure, of course.
We think that we provide a better education if it's in person, but, it has to be safe. So, one thing we learned during COVID is things change from day to day. So we don't want to, show our cards too quick. We're hoping for a full reopening in the spring, but a lot will depend on where we stand with COVID at the time.
Mm-hmm. Well, that's wise. That's a good move. That's very wise. Is there anything else that you would like people to know about Touro or anything else?
Just that, being a medical school here in Middletown and Orange County, we're very anxious to produce physicians from this area. So if you do have good students in your family who are looking for medical careers, who may want to go to medical school, please send them our way. To be honest, we get about 12,000 applicants a year for 135 spots. So we do get a lot of applicants, but we really do want people from this area. Our commitment is to Middletown, Orange County, and the Hudson Valley. So, and medical school is a great career. It's a great option. Uh, it's definitely, people don't always think of it as a potential career because of the years and cost involved, but in the long run, to save lives and deliver babies and treat emergencies is well worth it. And we're happy to be here and enjoy with the Chamber of Commerce members and the rest of the community. And we want to do more. So call on us anytime.
Well, I think that's what you said. It's a noble calling. It's a calling. It's not just a job. It's a calling what you do. And I want to thank you for everything that you do, everything that your students have done, and everything that your students will do in the future as they reach out and they really pour their lives into the lives of their patients and the surrounding community, because there's really nothing more nobler than that, than to give of yourself for the life of somebody else. So thank you so much, Dr. Steyer, for everything that you do. Have a wonderful rest of the day, and may you and all of your students be safe.
Thank you. Thank you so much, Lynn, for having us. And great job with the Chamber of Commerce, and thank you for everything that you do and
Well, thank you, sir. Thank you.
for this community.
Thank you very much. And thank you for everybody for watching. Please remember that on Wednesday, our Meet the Member will be with Janet Gianetto, who is from HR Visions. And we will be talking about all of the HR changes that are happening. We also, for our members, we are having a sexual harassment training on September 29th. It will be a Zoom meeting. Janet will be leading that, and that will be for compliance with New York State laws and regulations. Even though we are still in the middle of a pandemic, that does not mean that the previous HR requirements for sexual harassment training have gone by the wayside. You still have until October 8th to accomplish that for your employees. So please look to us. Please feel free to join up on that. You can sign up on Facebook, and it'll take you over to our website. And have a wonderful rest of the day. Please stay safe. Remember to wear your mask, social distance. We want to keep that transmission rate low. We want to enter into flu season without having a high transmission rate of COVID. So have a wonderful rest of the day, everybody, and stay safe.